In a common clinical scenario, the patient will present with a single lone standing tooth, very often the maxillary second premolar. Several treatment options are possible. This video suggests several design options to consider when confronted with this situation. For this scenario, our examination reveals the patient has a deep overlap of the anterior teeth. The patient has limited financial means. The patient periodontal status is excellent. The patient has a disto-occlusal alloy restoration which appears sound clinically and radiographically. The patient is not overly conscious of the aesthetics and will not object to a display of metal. The patient is missing the mandibular second and third molars. The illustration represents the clinical presentation of the maxillary arch. Examination of the occlusal relationship of the teeth is shown with red articulation markings. As a general rule, the partial denture design should be as simple as possible. Anterior modification spaces are usually best restored with a fixed restoration, thus simplifying the design and reducing the potential for unwanted movement of the denture in function. There are several options leading to the Kennedy Class 1 design. The lone standing abutment may be extracted. There are a variety of indications for extraction, particularly if the tooth is severely angled, requires a fixed restoration, or will result in irregular spacing of the artificial replacement tooth. If the tooth has been endodontically treated, one may consider the tooth as an overdenture abutment. Use in this manner may result in difficulty with artificial tooth placement, as well as the potential for fulcrum rocking of the denture. All other factors being acceptable, a fixed partial denture may be used to restore the pontic space. This approach simplifies the partial denture design, but may significantly increase the treatment cost. The premolar may also be used as a normal abutment, with short guide planes which diverge toward the facial. A mesial rest, vertical minor connector, and modified T form the clasp assembly. In other cases, the abutment may be used with guide planes only, with a cast round retainer on the cuspid. Several clasping options are possible. If distal retention is chosen, the modified T-clasp may be used. If retention is mesial, wrought wire, cast round, or I-bar may be used. In any event, retention distal to the fulcrum line is preferred. Common to each design option is the maxillary palatal plate major connector. The use of this major connector employs the hard palate as a third rest. Consideration should be given to the design of any previously worn partial denture and patient preference. Plating the lingual of the maxillary anterior teeth has several disadvantages which should be considered. Ladder-retained acrylic bases may be employed where vertical space permits. Well-heeled alveolar ridges may support a metal base when vertical space is limited. The design parameters suggested when number 13 is to be extracted or used as an overdenture abutment. Placement of rest seats determines the fulcrum line about which the partial denture will undergo anterior-posterior rocking. If possible, retentive clasps engage the tooth distal to this line. Acrylic bases may be relined. Metal bases are usually more hygienic and easier to clean. Distal retention is recommended when possible. The distal retainer will resist rotational movement of the partial denture away from the tissue, effectively acting as an indirect retainer. Maxillary retention with a wrought wire clasp provides no such advantage. The abutment may be incorporated into a 3-unit fixed partial denture. This design eliminates the modification space and simplifies the design of the partial denture. Use of this option may significantly increase the cost of treatment. The design parameters suggested when number 13 is to be used as abutment for a fixed partial denture. A vertical minor connector on the maxilla of number 13 acts as the reciprocal component of the clasp assembly. The cingulum rest on number 11 provides indirect retention. The design parameters suggested when number 13 is to be used as an isolated primary abutment. The 13th may be used as a normal abutment. Guiding planes should diverge toward the buccal. The amalgam restoration, if sound, may be retained. If failure of the restoration compromises the partial denture, a fixed restoration may be considered. Questionable restorations should be replaced. The modified T-clasp may be used if the retention is on the distal surface. The 13th may also be used with short guide planes only. Proximal plates associated with number 13 should be located gingival to the cingulum rest on number 11. Physiologic relief of the proximal plates may be required to limit binding when in function. Number 11 is used as the primary abutment, and may be clasped with a cast round clasp. This clasp is useful because it is more flexible than the half-round cast clasp, and may be used in situations where insufficient space for wrought wire exists. In this video, several options are presented in the restoration of the Kennedy Class 1 Modification 1 arch featuring an isolated premolar abutment.